Trying to get a nice background.
Hey, it's your afternoon girlfriend, Yvonne Daniels. Happy Thursday, man. What a beautiful day. And I thank you guys so much for joining us for this very special live. We are here today, of course, talking with our friends, partners, Great Lakes Bay Health Centers. We have got the Fund Development Coordinator, Jill Armentrout. Is that right?
Yep, trout like the fish.
Okay, there we go. And we have got the Great Lakes Bay Health Center's board member. She is the Assistant Secretary and patient, Tarshia Lewis. How are you ladies doing this afternoon?
I'm fine. How are you?
Wonderful, and so glad to have you all with us. We've got a very special event that's going to be coming up. It's going to be happening actually on Thursday, November 19th. It is the 5th annual Changing Lives Fundraiser 2020, a year of hope. It's going to be a virtual event, of course. This year, everything is kind of turning into the virtual thing. But this is something that you guys have been doing. And Great Lakes Bay Health Centers, you guys do so much in the community. And so we want to start off, before we talk about the fundraiser, we want to start off with talking about the services that Great Lakes Bay Health Centers offers for those of us in the community that may not know. So take it away.
Thank you so much for this opportunity, Yvonne, and for being with us here. I am live from my basement, so that's exciting. Yeah, absolutely. We're really so excited to share our stories with everyone in the community, and Great Lakes Bay Health Center is a great resource across the whole region, across the Great Lakes Bay region. We have 32 centers, including mobile units that we take services to people, and we are your community health center in 7 counties. We take patients, really you can come from anywhere in the state, and we have a 16 county footprint. But we have, like I said, we have centers and mobile delivery services in 7 counties. Most of our sites are in Saginaw County, and our services are basically medical, dental, behavioral health. And we're unique because we can put all those services into one place and really take care of anyone. You know, we are quality healthcare for everyone is really our overall, slogan. And that means if you have Medicaid or Medicare, which is most of our patients, or if you have no insurance, which is about 1/4 of our patients, you are welcome. You're also welcome if you have private insurance. But we have added centers, we've added services based on the needs in our communities, and we continue to do that and always stay in touch with what are the root causes of needs in the communities. And we add things like vision care. We add things like physical therapy. We have added a lot of behavioral health counseling and psychiatry, substance use disorder treatment. Like I said, we have 3 dental buses that take care out. We have 1 mobile health unit that will be also getting a second with a grant coming up. And we're really just here to open our doors to anyone who needs our care. And especially now when people may be losing their jobs or losing insurance, they need to know they don't have to lose access to healthcare. It's key. It's key.
Yeah.
And so that's what we do. And
so, so important during this time. And, as you talk about all that you offer, we've got, once again, Tarshia Lewis, and I hear you've been a patient for a while. So tell us from your perspective what Great Lakes Bay Health Centers has meant to you.
It's meant a lot to me. Being a patient since I was like 16 years old, and seeing the growth of the company, and then being able to become a board member, seeing the actions that we take to jump when a pandemic or a situation comes. All of that has meant a lot to me, and it has really given me hope for our community.
Wow. That's what you're calling this, the 20-year of hope. And who knew that we were going to be experiencing what we're experiencing now in November, even back in March. I think, we thought that this was only going to last for, 2 or 3 weeks, and it has turned into what it is now. So just with healthcare and all the things that are going on with the healthcare and, folks trying to keep their healthcare, and you guys provide quality healthcare for everyone. That is your slogan. So that means a lot. Do you see a rise, Jill, in the number of people that you're helping with this time, with the pandemic. You know, a lot of people are needing a lot of different types of services that maybe we've always needed, but even more so now. Do you see a rise in folks that are coming to you?
Well, you know, we took care of about 57,000 patients in our last year, in our last fiscal year, so in 2019. And to be honest, you know, because of our goal has been staying in touch with our patients this year, because we did have to shut some services down temporarily during the lockdown. And so we implemented telehealth right away, and that's been continuing and that will continue. But we are still working to get our patients back into our centers if they need to be, or just, you know, not falling through the cracks. You know, we know that cancer screenings are probably down. We worry about child immunizations. We want people to know it is safe to come in and get these services. And we want to make sure people get their flu shots, all these different things. So if you look at the overall numbers, we do definitely expect more people. We are hearing from people who have lost their insurance, and we have an insurance hotline because our community health workers can help you get Medicaid if you qualify, or Healthy Michigan, or come to us if you don't have insurance, or the marketplace. So that's a service. And they are hearing from people that said, yeah, I didn't know about you before. I had a job, I had insurance, but now I don't, and I don't know where to go. And I think that's going to continue to roll through, unfortunately, because we always work with the hospitals, and we work with the counties and the health departments, and they send people to us. You know, if you go into the hospital and you come out, you don't have a doctor, you need that care to continue taking care of you. You know, we don't want you to go to the emergency room, because that's not, you know, that's the place for you sometimes, but for your chronic health, your dental pain, you know, you need to come to us, because we are going to be your medical home, and you're going to get a whole care team, because all of our centers, like we said, have behavioral health specialists, someone who can talk to you on the day you come in. It's integrated with the physical health care, because it's all important. And then the dental is there too, because that affects your overall health. But it's also the community health workers who connect you with resources and can walk you through the insurance and the medication you're taking. Health literacy is really important. And then we have transportation, so that you can get to your appointments, because that's another barrier. So it's about removing all these barriers. That's what makes these health centers really unique. We're a federally qualified health center. That's the specific name for the kind of health centers we are. And they're all over the country, and they're all over the state, but we are the second largest group in the state. But, you know, so people just need to know that we're here. And like I said, it's not a walk-in clinic. We do take, you know, if you're a patient, we can, you know, if you have emergent care, you can come in, but mainly it's about the fact that you have your doctor. This is your doctor, this is your dentist, this is your counselor, and they are your team that's going to take care of your whole health. And yeah, it's pretty amazing. And so
that is amazing.
To know about it. Yeah.
That just warms my heart, because, you know, people need to know that. They need to, it's like support, you know, you need to know that you got someone that's there, you know, in when you need help trying to figure all this stuff out, you know that you need something, but it's like, I don't, you know, so it's so wonderful that you guys are this place where people can come. And so that's why it's so important, because, you know, with all of this takes funds, it takes money to continue to keep this running, you know, and to make sure that all of the needs of the people are being taken care of. So that's why you've got the fundraiser that's going to be coming up. So tell us a little bit about that. So, yeah.
Yeah, absolutely. You know, we can't have our luncheon like we normally do. We've had those for 4 years, and you know, we always feature patient stories. We have some new patient stories this year, and so what we're going to do, you know, we were able to capture a lot of some of our healthcare heroes. You're going to get to see a look at the testing site where we're doing drive-through COVID testing. You're going to hear from Dr. Brenda Coughlin, our president and CEO, who's also a family physician. Our host is Dr. Wahid Akbar, and he's an orthopedic surgeon who's also been a very strong partner with us. Of course, you're going to hear from Tarshia, representing our board, and it's going to be 30 minutes, but it's going to be on Facebook, and it'll be, you know, premiered there live at noon and at 7 on November 19th, next Thursday. And not to be any confusion, people can just go there and watch that. We do have, of course, a website and information there, and that's where you can give. You can register for this there too. However, you know, it will just be accessible to you on Facebook, and the video will also be accessible on that website. There's no special link that anyone needs to have. They can just tune in and join us. And that's what we're really excited about is to show this, because we do have needs. Our response to the COVID pandemic has been very, lots of different things have had to happen to help our patients and help the community in general. And so the drive-through COVID testing started in March, and we have it at 3 of our centers. And it has been very important and ongoing and very hard work. And now we are continuing to need to continue to hire more testers and screeners to do the paperwork. Currently our operation, I know 2 days ago or a day ago at our Saginaw Testing Center, we did 340 tests, which is an absolute record. And, it's just been a lot. And we also have a site in Bay City at our Bayside Health Center, and also in Bad Axe at our Thumb Area Health Center. So they are out there doing this work, and they're going to continue in the winter. And so we have to continue to figure out how to do that and keep everyone safe, keep moving the cars through. The demand has become pretty overwhelming, just because it really has, we know people are really wanting to know what's going on with the cases increasing. So that does mean tents and heaters. And we did move our site from our downtown Lapeer address, because we're doing some renovations there. So now we are at 1417 Cumberland in Saginaw, doing testing there from 9 a.m. to 1. And people should come out early, because the waits, unfortunately right now the demand is really high. But so we do need the support to help keep that going. And we know it's going to become also, we'll most likely be involved in COVID vaccine distribution. So that will be another logistical situation, and the flu shots now too. It's very important. We're figuring out some other ways to promote getting flu shots, all the safety equipment. So when we bring our patients back to our centers, we have to do it safely. And that includes, definitely a lot of work involving the screeners at our doors. So having the people to do that, and having all of the air exchangers, and the telehealth technology, making sure our patients have the technology to be able to communicate with us through telehealth. And then behavioral health needs are really, really expanding as well.
Okay. So the money has a lot of places to stretch out and go to make sure that you said everything is rolling and continues to roll safely. And I did just hear, I was telling someone recently that I hear that the governor now does not have the power to mandate masks. And so, of course, like you said, we're seeing an increase in number of cases of COVID-19, just that and coronavirus. And so you said that the numbers are increasing as far as testing and your testing sites. You're seeing more people coming out to get tested, right? So the lines are getting longer for that, right?
It's very true. Yeah, absolutely. And so we're doing our best to, we have to have our safety staff out there at the Cumberland site. The police are there helping us, monitor the cars. But that's true, and we're trying to encourage everybody to be safe. And wear masks and be safe. And of course we require those, but some of it has been just getting, we have to have all the PPE for all of our staff. And then also making sure that our, people have donated masks for our patients, because they need them to come in the center, but they need them just to live their lives now too. There's a lot of needs. There are definitely services, like I said, that, our patient care, we do bill insurance, and that is the main, our main source of funding. But then we have things that are not reimbursed, and that includes the transportation and the community health workers, and then all of the all the patients that are uninsured that come to us. So we're always working, and that's really, how we can balance everything out is to talk to our community and tell them about what we need and let them help support us. And they have been, and we really do thank all the donors that have supported us this year and since we started this effort.
So can you tell me what your goal is? Is that something that you can say or may or not? what you're trying to the amount you're trying to get, or no, not necessarily?
Yeah, I mean, we have talked about that for the most part. We look at overall things that we have needs for. We've talked about a goal of $100,000. You know, we have had we do have a group of donors who are part of our Giving Hope Society, and they pledged 5 years sustaining gifts to us, and you know, that's been wonderful. We would, you know, we'd like to build that, but there are definitely opportunities for people to give
Yeah.
gifts just, you know, out of this event. But then we know we will hope to continue to cultivate and talk to our donors and stay in touch with them so that they can grow with us and maybe continue to be part of our efforts. But yeah, absolutely. Like I said, there's been a lot of generosity already. We have many foundations in the communities that, you know, we have a lot of work done to receive some grants from them. But there's definitely, you know, for community members to give back and help support the services that they are seeing out there to help make the community safer. And it's
Right.
absolutely true. When we have a new service or we have something that's special that we can't be reimbursed for, we don't want to lose those services. Or if we
Right.
have a grant project, we don't want to lose it. So we're always, you know, we need to find ways to make that sustainable. And
Yeah.
it's true that the need grows, and as the need grows, we need to make sure we have space in our centers to see everybody. And some of them are, we did open a third center in Bay County about a year ago, and that was that's where we have behavioral health, psychiatry. We now have a pharmacy there too, and we'll be expanding the substance use treatment there. But every time those kinds of projects happen, that's a big move forward and something that, you know, we have to work hard to make sustainable.
Yeah. Well, you know, and I think that there's power, you know, it's I think back to my mom who first started giving towards and not to talk about politics, but towards campaigns back maybe about 8 years ago when President Barack Obama made it possible to give and just the power that she felt just in being able to give her $5 or $10 or what have you. So I think that for people to be able to give, it just gives them whatever the amount is that they, you know, can give. It's like power. It's like, you know, I'm taking control. I have control over what's going on in my community because I'm giving to an organization like Great Lakes Bay Health Centers who do so much for the community to help you continue and help these programs, you know, to be sustainable. So I think that's wonderful, you know, that the community is able to give, that you're giving them this opportunity to do that. So will this be the only date that they can give, or can they give on an ongoing basis?
Yeah, we would love people to, you know, share the presentation. That'll be a video that will be on our website, and absolutely, the opportunity to give through the website will always be there. And we'll continue to share. We'll continue to share the video, and, you know, especially through the end of the year with Giving Tuesday as well. We'll talk about it more then. You know, and there are other things too. I mean, we just want to hear from the community. We want to have everyone know what we offer. You know, we have had volunteers from SBSU and CMU have come out and helped with some of our testing events. And so those are some volunteer opportunities, and they've been great. And, you know, Tarshia is a patient. Our board is mostly patients. So we definitely have ways for people to be involved. We normally do walkthroughs of our centers, together event tours. Those have become virtual right now too, but that is one of the main ways that we tell our story. So that's another way to be involved. But absolutely. And Tarshia, you know, if you want to say anything just about how you became a board member, I think that's a good story too.
I got a phone call, and somebody the person on the other end of the line told me that somebody had recommended me to be a member for the board. I didn't know what all it came with, but and I just knew that I would have an opportunity to be an active person in my community, you know, to be doing something to make a difference. So I jumped on it, got interviewed, and I've been with them for 6 years now.
Wow.
Yep.
Wow.
Now, when my last meeting, I was able to be granted with the position of the assistant secretary, and I'm looking forward to us coming together to do more things for the community. I'm looking forward to seeing more people in the community to becoming a part with us with their donations, and us jumping on top of things that need to be taken care of, and continuing to bring smiles to people's faces like they say Center brought smiles to my face.
And it's a beautiful one too. So Yeah. I hear
Thank
the
you.
passion, and I see what, just being a part of this organization has done. I mean, you're just radiating. So that's wonderful. And I get a feeling that's what Great Lakes Bay Health Centers is all about, just supporting the entire person, from mental, physical,
Yes.
all of that. So, but we know definitely that we're dealing with this pandemic. So we know that we also have the COVID-19 pop-up testing site that's also going to be coming up this Saturday. We're going to be doing that at Bethel AME Church. So that's also going to be going on from 10 a.m. Until noon. And there's the address right there on the screen, 535 Cafe Street. So you're going to have folks out there as well for that. Not only with that, but also free HIV screenings are going to be happening there as well. And a free fresh produce giveaway. So, man, you guys are doing it all.
Yes. Yes.
Yeah,
We try.
this is the fifth one I think that we have done. We did them all during the summer, and we worked with partners in the community. We worked with Buena Vista Township. We worked with the Latinos for Saginaw. We worked with other churches, New Life Ministry. I think I'm saying that right. So, we have these partners in the community to take the testing to places where maybe people, if they weren't coming to the main site, where they would have the trust of the church, of leadership in their community, especially to get to neighborhoods where we know that because there have been higher positivity rates among, different groups, African American, Hispanic. We see those. We track and we do look at people. We want to find out, what is your race, just so we can track and see how is this affecting people, and it has affected different groups differently. And so building the trust to help people understand you can come and get the test done. Right now the drive-through, all of the testing, you don't have to have a doctor's note, and you don't have to have an appointment, and you don't really have to have specific symptoms. You can know of an exposure. And we do bill insurance for the testing, but there's no charge when you pull up. We do ask you to bring your insurance card. If you don't have insurance, just like with other services, we will be able to do that test for free. It's the nasal swab testing. And the event on Saturday at Bethel AME Church, that's a great partnership. We do expect a good number of people to come out. We're hoping for more than 100, maybe 150 people. In 2 hours, that's a lot of COVID testing to do.
Yeah.
But that will be a goal. And, to get them there too, they can have the produce. Then the flu vaccine also will be available. So we're basically going to have and this is the most we've ever done at an event. And we started small. We still had good numbers, but just doing the testing. And then we wanted to add information. So we give out bags with information about our services, and we were promoting the census, and we were promoting voting. And then we added HIV testing, because we do have a whole health center just dedicated to HIV outreach, free testing, and treatment for HIV and AIDS as well. So that's our Hearth Home site. They'll be out there. We'll have our medical bus and some of our behavioral health team, and they actually will be able to do Narcan distribution. So those kits will be going out. So it's just going to be kind of an assembly line. You come on through, and you don't have to get out of your car, but we will offer all these different services to you. And we have a lot of staff volunteering, and staff that'll be there. And we have a lot of volunteers from the church. Like I said, some students that'll be there, because it's a whole big operation, but we are excited to have this happening. And it may be the last pop-up that we do this year, although we'll look at other ways to make sure that we continue to bring the testing where it's needed. For example, we do our migrant outreach all summer to the farm workers, and a lot of testing happened. That's how our organization was formed 50 years ago. We started with migrant farm worker outreach.
Okay.
And that continues all summer long with our team that goes out and provides medical. They also can offer some behavioral health and dental. And this year, it was all about educating about COVID, and it was educating and doing testing. There was a very high positivity rate among farm workers, so helping them protect themselves was important.
Man, this has been. Go ahead, Tarshia.
Speaking on the testing, I want to speak to the viewers on the receiving end of the testing, because if you haven't got tested, I know you probably seen videos and they look like it hurt or it's a scary experience. But when I went, it's not bad. it's not what it looked like. They don't go as far back as people say that they do, and they're not touching your brain and your eyeballs. It's comfortable. It's a comfortable procedure, and it's over before you know it. And they'll even let you put, spin your own Q-tip or whatever, so you can be comfortable. But they do make sure that you got it in there where it needs to be. But it's not a scary procedure, so please come get tested. Come get tested, please.
Yeah. You definitely need to know your status. You definitely need to know that. And I feel better than I did when I started this, because you guys do so much. This has been jam-packed with information. Once again, the 5th annual Changing Lives Fundraiser 2020, A Year of Hope, happening Thursday, November 19th, which is actually a week from today. The virtual event, we got the information there. You can go, like you said, you don't have to register, but you can go and watch the presentation. You can give, and you'll be able to give on an ongoing basis. And you guys, just all I can say is continue to do the good work that you're doing in the community and for all. I will be out there joining you this Saturday from 10 a.m. till noon. So I'm looking forward to that for sure. And I thank you all for joining us so much, those of you that are watching. And I just would really encourage you to share this. You can share it on your Facebook page. You can go to our KISS 107.1 YouTube channel and watch it. Just watch it from beginning to end. You're going to learn a lot about what Great Lakes Bay Health Centers does, about the fundraiser, and why you should give. I think we all should give because this affects all of us. So once again, Jill Armand-Trout, the Fund Development Coordinator, Tarshia Lewis, the Associate Secretary, I should say. Thank you guys so much for joining us, and keep a good fight. And I'll see you guys on Saturday, okay?
Thank you.
Thanks, Yvonne. Thanks, everyone.
You.
Thank you, Tarshia.
Bye-bye.
Thank you.